Today, doctors have claimed they will strike until the next general election and beyond, to infinity and beyond, like Flash Gordon or whoever it is, in their dispute with the government over pay. Consultants and junior doctors started their three-day strike yesterday, many travelling all the way up to Manchester, where I'm at the Conservative Party conference, to a rally in the city. This week's strike marks the longest joint strike action of doctors in NHS history, with an estimate of 2 million planned appointments and surgeries cancelled owing to the walkout, with an ever-expanding waiting list of 7.7 million. The Health Secretary, Steve Barclay, stated at this conference today that doctors are demanding extortionate pay rises, even if this means money is diverted from patient resources. Let's have a look at what he had to say.
The militant BMA leadership, whose strikes have resulted in countless cancelled appointments and pose a serious threat to the NHS's recovery from the pandemic. Their consultants and junior doctors committee are relentlessly demanding massive pay rises, even if that means diverting resources from patients, and despite junior doctors having already received a pay rise of up to 10.3%.
I'm now joined by the GP, Dr. David Lloyd. Dr. Lloyd, thank you for joining me. How can this strike by well-paid people be justified?
Well, like everybody else, I think we have a right to strike as doctors and nurses and other workers in the NHS because of our pay and conditions and because of the way we're treated.
But just because people have a right to strike doesn't make it right to use it, does it, when patients are suffering? What about the Hippocratic Oath, or does that count for nothing to doctors anymore?
It certainly does. I want to see doctors and nurses working in a system that gives people the best possible care. We've known what it's like.
But they're not. They're on strike.
No, but under Labour Party, when the Labour Party were in charge, we knew what it was like to have a functioning health service, and we knew what it was like to have doctors and nurses who work properly. At the moment, we're being looked after by our health secretary and by our leaders in an appalling way, and the average consultant in this country is now £42,000 a year less well off than he was 5 years ago. So it really are.
But he's still earning over £100,000 a year, isn't he? So that's just pretty greedy of the consultants.
How much do you think someone who is making life and death decisions every day, 3 or 4 times a day, who has skills that have taken many years to acquire, how much do you think he or she should earn?
Well, I think earning over £100,000 a year is a pretty good salary.
Well, how much would a person who was of that skill working in, say, a private equity firm, how much would he or she be earning in an equivalent rank?
I'm glad you mentioned comparisons, because 1 year after graduating, somebody in medicine is earning £37,000 against the average for graduates of £22,000, more than somebody veterinary, nursing, engineering, economics, physics, etc. And after 10 years is at £56,000 against the average of £32,000. So people in the medical profession are earning more after they've graduated than people in almost all other professions.
Well, no, I specifically asked you about private equity. I mean, 10 years down the line,
private equity is completely irrelevant. It is completely irrelevant to this conversation. Private equity is an esoteric part of the city.
The brightest and the best coming out of schools in the old days would have thought of medicine as being quite a good career. No longer do they think that. And the first thing they think about is, let's get into the city and earn lots of money, because that is where people are best rewarded. In the old days, you would be rewarded by work.
So you're saying doctors just go into the profession for the money, not for the vocation? I thought it was a vocation for doctors.
Yes, but you can work as hard and have a love of your profession, which I do, and I've done for the last 46 years. But you do need to be paid as well. And these poor doctors are being paid less and less and less, and they're now 26% less. Their salary is worth 26% less than it was 5 years ago, whereas someone who's worked in the financial sector, I'll widen it to the financial sector, is now 5% better off. They are being shafted.
But no individual doctor is 26% worse off. that they've got pay rises and they've got grade rises. You're talking about pay bands, but people have moved within pay bands. So this is a bogus statistic.
Consultants are 26. They've reached the top of their pay band, so they're being paid an awful lot less than they were 10 years ago. I'm sorry to talk about money when we're talking about health, but it is a package.
But these consultants are on strike because of money, aren't they? And they're abandoning their patients and waiting lists are increasing. This is an abandonment of patients, and it's shameful, of well-paid people.
It's not just about now. We're talking about the future as well. As I said, if you ask people nowadays whether they're thinking about going into medicine or not, they're rejecting medicine because they don't think. Go on.
So why are applications to medical school massively oversubscribed if everyone's rejecting medicine?
Because there aren't enough medical school places to provide the doctors we need.
But if they're oversubscribed, it's clearly not the case that people are rejecting medicine. It can't be.
No, it's because this government have said that these new medical schools that they were so proud of cannot accept UK students because they can't afford them. So they're full of foreign medical students that have come in, they're paying their whack, and they're not letting our homegrown students become doctors and nurses.
But the medical schools are full. Anyway, thank you very much, Dr. Lloyd. It's good of you to join me.